Hi, I'm Ryan Hunter, and this is Kalispell Connections, a program where we talk about issues important to the community. And with me today is Connie Behe, the director of Imagine If Libraries. Hi, Connie.
Hi, Ryan.
So you are the first recurring guest on Kalispell Connections. And I think that is maybe partly because the library is getting a lot of attention lately. You've kind of been on the front lines when it comes to working with the public with regards to the pandemic, and particularly a lot of interest in the mask policy at the library. You've had a lot of conversations about that with the public. So maybe you could touch on that and kind of what your approach has been and where you see things going with regards to wearing masks at the library.
Yes, from the very beginning of the pandemic, when we actually, a year ago, when we were all wondering what was happening, we closed for about 4 to 5 weeks while we were determining how to redesign our spaces, built an online work environment. And in my mind, as library director, I've always felt like I owe it to the community to be open and provide the most services possible. And I needed to advocate for the right safety precautions ahead of time in order to be open. Taxpayers are paying for this service, and we can provide the most services when we are open. I recommended to the library board that we adopt a mask policy in the library 2 weeks before Governor Bullock adopted one statewide. And that policy has remained in place. It has been confusing for some people who really would like to come into the library without a mask. We have all kinds of accommodations, but I think people are really missing out on the experience of browsing materials in the library. And when I look around and talk to people, I hear and I see that a lot of people have been deeply hurt by the pandemic and want things to return to normal as quickly as possible. I've recommended that we keep the library the mask requirement in the library until June. That's a draft recommendation, and we're working towards it right now, but I always have to take the most recent information, weigh the most recent information. So that's my disclaimer that hopefully it won't change, but that's the plan for now. And I think that if we keep this focus on keeping staff healthy so that they won't all be out at the same time, that was at the heart of the mask requirement. If we have multiple staff out at the same time because they're sick or they need to be quarantined, then we cannot be open. So that has been the priority, is frontline staff in a safe, reasonably safe environment with reasonable accommodations for people who can't wear a mask in order to stay open and do my job of providing the most services possible. We just saw today that Gianforte said April 1st, all Montanans will be eligible for the vaccine. 84% of our staff would like to have the vaccine. It's all a personal choice. But as we inch closer to that, and we had several members qualify already, we are closer and closer to a time where we will be able to have staff protected so we're not all out sick at the same time if that were to happen. And so then we can have a little bit more flexibility in the library, because I really want to have everyone having the full experience that they can in a library.
And a testament to your success at the library is that our libraries have been open. I mean, I understand across the state that's not necessarily the case. Is that correct?
Right. For a while, we were one of 2 large libraries open to in-person traffic. Then it was 3, and now it's 4. So that's pretty great. We are not all open at the same amount. The 4th one that just opened is by appointment only. We decided, because we cannot socially distance when we're working on the front line in the library, that's why the mask would be required. And when you're coming in to pick up a holder or something like that, you probably could socially distance. But for library staff, we're working with people's accounts, showing them the next books, and working with kids, they're so visual, you can't just point to a shelf and tell them where to go get that stuff. So I thought that instead of counting the number of people who can come in, I, with the leadership team, made the recommendation that, again, keep the masks on so we can have hundreds of people in a day and not have to require 10 people in at a time so that we can keep everyone distanced. So that's been the ethos as well, of having just wide open doors for a certain number of hours a day. And we have over 40 people, 400 people on average coming through the doors a day, hundreds of people coming into all three of the locations.
Yeah, that's incredible. I mean, I don't think people realize just how many people come through the library. I mean, there's a lot of people that use the library, and there are a lot of people that come through there over the course of the day. People don't quite realize. You know, one of the challenges here is just the balance between the different perspectives. Obviously, there's a lot of people who feel very passionately about their, being upset about being asked to wear a mask. But there's people who feel very passionately on the other side about, wanting to have places where the masks are enforced and they can feel comfortable and use that space. And I know part of it too is also your staff, right? I mean, they have their own perspective on it as well that you have. So you have these different constituencies. How has it been kind of balancing that and communicating with each of them?
It's been a challenge. We have a librarian say, they didn't teach us that in library school. I'm sure all careers have that, but I have not said that more than I have this year, because they definitely didn't teach pandemic management in library school. But we do have a great staff, very healthy communication where we don't always agree, but we work on it. But yes, at any given time, I've made recommendations that hurt at least one interest. As I recommend that we move to fuller services and that we will intermingle in the library when there's a safer situation for staff. I've already received people expressing concern over that. And I have to weigh that concern with the concerns of people who have been feeling like they're missing out. And people are genuinely concerned about the health of their children or wearing a mask or things like that. I have to weigh all of that with the information I have from the public health officer about social distancing. I think where I've fallen along the way is a very moderate and measured approach. And rather than taking away services, trying to have the services there with precautions. And to just be as transparent as possible about the thought process, knowing that it's not going to be a perfect answer, but it's better off if people know you're thinking along the way. So I think that has gone a long way, even though it's more difficult in the moment because you don't have all the answers. People will ask you for the answers, right? And I don't have all of them, but I think that it gives people more of a chance to be part of the solution with me and to understand all the different parts we're constantly balancing.
Yeah, I've certainly have heard about just compliments about your communication in the community about this in recent months. So it's doing a good job. And so you're looking at a June timeframe for hopefully opening up and allowing for more of the freedom. Kind of what are the benchmarks or things you're looking for to hit that target and you're thinking there?
Mm-hmm. I appreciate that question, actually, because I think that sometimes what gets lost in discussing all of these service elements is that with a system our size, it actually takes quite a bit of time to plan for any change. And it's a domino effect. So we're working toward right now that we will be open all hours with the mask requirement in May. And in order to do that, we stopped today the quarantining of materials. Our caseload is very low, and there's a lot of information about low transmissibility rate with materials. So we can safely stop doing that. And our meeting room is full of books, though, that are waiting to be processed. And in order to have staff who need to be intermingled at different levels of immunity, we need to have that meeting room for staff spaces. So that's what we're working through right now in order to be open the full hours at all locations in May. And as we work through that, we will determine how many programs it's safe to put out. We've already planned our summer program, and now we're looking on how to backfill that with in-person programs outside. So there's a lot of planning for even the next year out happening at the library right now. So having a little bit more of a runway has been important for us to work up to that eventual and hopeful June reopening with a choice about whether or not to wear the mask inside the library. And I assume that people who feel most vulnerable then, who have been able to come inside, we've had vulnerable people using curbside this whole time, but some people will choose to use curbside instead of coming in with intermingled people with masks or without. But at that point, we have a relatively safe environment for staff. I can no longer, in my position, recommend a full mask requirement, in my opinion.
So to move on to another topic that's gotten some news lately, both nationally and I think a little bit locally, is the Dr. Seuss books. They have, the publisher has decided not to publish some books that no longer, I think, meet some folks' standards in terms of decency. But you know, that comes to the library. Obviously, library stocks Dr. Seuss books, and so I was hoping you speak to that. I know people have inquired with you about that. And what's your approach on that?
It's our job to give access to information, and we do not remove historical books based on changing societal norms. If we did that, we would have many books banned from the library, like Huckleberry Finn. So we will retain those books and give and hold the right for parents to choose for themselves and for their families, and for people who don't want to see it to be able to discuss that with their families themselves. But we retain those books in our collection because of the freedom to read and access information. We do have 2 of them. All 6 of the publications were not in demand or popular. And so I think that, I know people are concerned about not having access to those, but I'm pretty sure that about 4 of them were not really on anyone's shelves anymore. But we'll have those 2 in our children's collection.
I know there's been discussion about you're having discussions with your board about budgetary concerns and some of the pressures that the library is under in terms of space. And could you speak to that in terms of really where the library is in terms of providing its services and the space you have available and the infrastructure and all that, and what your needs are? Because a lot of people, they go in, they have a wonderful experience at the library, all those 400 people a day coming in, and they don't realize that you know, some of the strains and challenges that you're facing there at the library. Could you speak to that?
Sure. And you know, especially in our community where we have multiple generations of a family living here, people are deeply connected to this building. We in Kalispell, we're in a 1917 federal building. It's historic registry. It's beautiful. From my perspective, it does not meet the needs now or into the future of what our patrons need. It's owned by the school district, and their administrative offices are on the 3rd floor. None of our buildings are ADA compliant. And none are efficient. We're on 3 floors, which is very inefficient to staff. We also, according to a facilities needs assessment that we had done in 2014, we're undersized at 3 locations: Columbia Falls, Big Fork, and Kalispell. In Big Fork, there's such a lack of accessibility that if you need to use the book drop because you have a different mobility or mobility issues, you need to come to Kalispell to use it, because you will not be able to reach the Big Fork book drop from your car. That I know, as my job as library director is to take care of problems like that. Right now we are in the middle of a capital campaign in Big Fork where our foundation is raising $1.6 million and then renovating a building they purchased at a great price, and the community is really going strong. There's a lot of momentum built for that. In order to plan for that facility, I'm looking at how we are going to reallocate our budget as it is. And so that means that we will all have to make difficult choices. Will we, without an increase, we will need to take time away from Kalispell programs in order to have a program in Big Fork. When you walk into this 1,400 square feet in Big Fork, when we have programs going, some parents will walk in, turn around and walk out because it is so packed. They're just overfull of children. And in Kalispell, it's the same way. We have 4 programs a week for children ages 0 to 5. And there will consistently be 50 children in this small area with the parents and family and grandparents that they have with them. Our children's librarian told me, well, I actually counted 72 one time. So I'm just talking about an average, but she's seen quite a bit there. It's no longer a reasonably safe environment. And so with those types of space constraints and constraints, we can't add another program without more staff time. We will have to make difficult choices like, do we cap the number of people who can come into those programs? Other libraries have had to do it. We could sign people up online ahead of time, or we can have first come, first serve. I'm anticipating a whole lot more kids too when we reopen our programs in full, because I think that we all can see how many people have moved into the county, into Kalispell, and I'm so excited to meet our new neighbors. But I know the children's department will be pretty packed. I'm probably missing some of the key issues that we are working with as far as our budget goes. Oh, another main area though is our collections. Our materials budget has been static because the main costs we have are paying for our staff expertise. A service like ours, you can't be open without staff on the floor. And then our materials. So people will have to wait longer for books if we aren't able to grow our collection with our community. We are balancing right now a lot more digital, but people still want print. Digital is actually expensive, but we cannot keep up with that. So people will have less to choose from the on-demand downloadable digital titles and wait longer for materials in the regular collection. We have also heard from more and more parents that they really want browsable titles, especially browsable Christian titles in the children's department in Kalispell in particular. And to have a great browsing collection where things are there and they're not being put on hold requires more materials budget. So those are the difficult choices that we have to make as we go along. And our budget has been at a steady level since FY17. So as I look forward to now and generations into the future, I want my kids and I want my grandkids and invest in this community. I want them to have the experience of coming into the library. And the decisions we make right now really do set up what's going to happen into the future. And the further we get behind, the further we fall behind, it's so much harder to catch up. And eventually we just won't be able to fulfill our mission to the community.
Yeah, well, as with my family, we are active patrons of the library, and we certainly want a strong library as well. So certainly sympathetic to that. But you have a challenging job. It's I think just the topics we talked about today are all challenges, and you do a great job with it. Your staff do a great job. So I'm just very appreciative to you and your staff at the library. And thanks for coming on the program and sharing with us.
Thank you, Ryan. I feel like I am called to be in service to the community. And so that's why I have this job, even though there are all these challenges. It is very rewarding to be able to give to the community like that. So, but thank you for the appreciation and thanks for the interview.